Hey, Chronically, and we're back. This time, it's only me. It's a solo episode. And I came back recently from a conference, a joint conference of the Israeli German Ministries of Health. And the main subjects were AI and data in healthcare. I had the privilege of leading a session about patient ownership over data and health literacy alongside a fellow patient expert, Birgit Bauer. You should look her up. She's an expert in anything that data and patient and AI has to do with. And I just thought to myself, it's great. We have buzzwords now. Everybody's talking about AI in healthcare. Everybody's talking about innovation in healthcare. But we tend to forget again and again and again health IT. Each of the components of our health delivery is eventually highly dependent on functional and usable health IT, which is failing. And all these conversations are often missing something that for me are extremely funny that they ignore, which is patient ownership over data. And yes, there are so many experts and so many subjects, like sub-subjects, and many, many different threads we can pull on this one. But I wanted to touch base on something that has been bothering me tremendously lately. I'm seeing more and more within the wellness realm, okay? Let's put aside healthcare and use wellness as an example. I see more and more services designed around providing people that are not defined by the provider as patient or what we call consumers. And those services are meant for something that is called consumer health. So basically, you are not defined as a patient. You're not somebody that has an illness and you need to specifically consume it. Those devices or services are not usually with any requirements of doing FDA certificate or CE certificate or another type of, even HIPAA, most of them, all of which are very important within the health care realm when regards to patient services. But the Wild West of consumer health and wellness is very interesting because more and more companies are offering us data analysis services. And what I mean by data analysis is that, for example, a fitness tracker that you pay for, let's say $200 or $300, sometimes even more, and then you are locked in some sort of a subscription-based program that allows you to analyze and see the data. So let me just repeat it for a second. You are paying for a device that is monitoring your health parameters, your fitness, tracking your data. One of the most personal, sensitive pieces of data that are out there is those pieces of your vitals, of your sleep patterns, of your fitness, of your activity, of your stress levels, of your mindfulness levels, and so on. Some of those parameters are extremely sensitive. Menstruation tracking, skin temperature, sometimes even 2-lead, 3-lead ECG, heart rate variability, pulse ox, which is the oxygen level in our blood, and more and more and more. We are the consumer that is required to pay for a device that will track it because we believe that we want to improve our health. And a good way to do it, alongside with the fitness trend and wellness trend and the quantified self trend, is to actually use trackers. Wearables are amazing. I have nothing against wearables. Every time I speak, every time I write, I mention it, that this is the future of patient care. This is the future of chronic illness monitoring. This is the future of prevention. I'm all for wearables. But when we are required to pay for the device, in some very rare cases, we're not really paying for the device, or we just pay a sort of rental fee or subsidiary fee. And then it's like we pay for something that is ours, and there is a gateway. Because the device is a gateway, we can probably not monitor it ourselves. Of course, there are a lot of projects. There are amazing open source projects even in I don't know, around $30-40 of components. You can assemble your own health tracker or your own smartwatch. And there are a lot of OEM manufacturers in China that you can customly build and design and order your own device. But let's say that 98% of the people or 99% of the people will not do it. Most of these people, like me and most of you, are way too busy or not technologically inclined enough to go that deep into the quantified self. So they will look for an over-the-shelf or over-the-counter solution. In that case, we are basically stuck with one of a few giant companies. Some of the companies or the players in the fields are not that giant, but they are with huge backing, which is good for one hand because maybe our data will be kind of secure. But on the other hand, if there is one thing that drives me completely insane in the last few months, is hearing about more and more of these services that require you to pay for them to analyze your data. I want to just clarify something. The data analysis, this is not the hard part. This can be done with very simple or very complicated algorithm, mostly on the phone side or on the watch side, and sometimes it's being sent to the cloud and being analyzed there due to computation limitation or other architectural constraint or design constraints. But bear with me for a second. Those pieces of data that you pay to be analyzed are also, and more than often, if not always, being sold to third party. And I'm not talking about universities and research companies, and you know what, even pharma companies that are going to use this for our own benefit. We are not opting in. I never seen any device that asked me upon the first prompts of setup to kind of maybe opt into a research or ask me if I'm a part of a patient organization or if I'm a part of a health system of sort and I want to take part or I want to anonymously share something. No, you have this AGBs thing. You have this huge kind of agreements that you're usually just scroll down and accept. If you read them carefully, most of them will state that this data can be used upon the discretion of the provider. So if I'm paying for a device, a one-time fee or sometimes like a rental fee, then I'm paying for a subscription, and this subscription allow me to read my own health data, okay? And then this data is being sold. And trust me when I tell you that the majority of the sum of money these companies are making are not from selling you the subscription, but by selling this data. And I'm here as a patient advocate, come here today to say one very, very simple thing. This is our data. You should pay us. And I think the scheme should be completely reversed. I think that just like any patient-reported outcome or patient voice input, just like pharma companies are paying patient experts or paying for people with lived experience and caregivers experience data, there is something huge in this realm that is called patient experience data. It's a huge market, billions of worth. I think that those tech companies, those wellness tech companies, should pay us if they want to use our data. I think that everything that is being done on the device or on the phone itself and being analyzed, it's my data. And if you want to give me access to your algorithm, great. If you don't want to give me access to the algorithm, I will probably opt in to use Apple Health. Some people will choose Garmin Connect or Google Health or Samsung Health or Mi Health or wherever geographically you are. This is another topic with privacy concern, but if I am starting to build an ecosystem, which I have 3, 4, 5 devices that are tracking me constantly, and I'm producing this oil, this gold of data points, I think that I should get paid for it because the value of this data worth billions. Pharma company needs it. Research organization needs it. Other tech company needs it. Everybody who is designing any product that has anything to do with health would benefit greatly from patient experience data or user experience data of such. And therefore, I'm calling here today for raising our voices and demanding that this should be changed. And there are especially 2 big companies that I'm not going to mention their names within these tracking realms that are basing their business model on subscription. And whenever I'm asked if I'm using one of those because their products are well polished and people say they're amazing, I say no, I will never pay to get somebody else's my data, making money out of it, and get it back analyzed in a form of a trend. I think that this is exactly part of the problem. The paternalism we see in healthcare, this approach that patients are more of a kind of a bystander that kind of collides into healthcare and being treated poorly many times, or patients are a source of revenue. I think that it's getting more and more prevalent among tech companies as well. We see chief patient officers and patient engagement officers within pharma. We don't see it within tech. We see medical officers. We see the trends that maybe one day the largest health providers would be tech companies like Google or Apple or maybe Walmart that are going in with some sort of partnership and so on. But I don't see the trend going into more of patient-centric, user-centric, human-centric design when thinking about those products. And in this specific regard, this is our data, this is our ownership over it, and until the day that we will have more opt-in, comfortable, regulated, it's probably going to come from Europe because I can't believe that the US will do it first. I really think that you should pay attention to what agreements you sign in when you buy a smartwatch or any health tracker of some sort, like a smart ring, a smart fitness tracker, a smart band, or so on. And if they want money from you, I would think maybe twice about it. If they don't want money for you, it doesn't mean that it's again okay, because as everybody said before, if you're not paying for it, you are the actual product, which is correct. But there are some use cases, like with Apple, specifically what I'm witnessing, that is slowly building an ecosystem of health, kind of an operating system of health services. And there is another trend, which is to take as much money as we can, but also sell it. Let's be transparent. Let's co-design products with patients, and let's ask for our opinions before we put anything that belongs to us up to sale. Have a good week and see you in the next one.